All right, so I'm Ben of BenRN, and I'm basically doing these videos for prospective nursing students or nursing students who are, in their first semester or about to begin their first semester. Um, it's a confusing time. it's it's something where you're not too sure exactly what you're getting yourselves into. Um, Maybe you even have these preconceived notions of what nursing school is. I, for one, when I first started my accelerated nursing program, I thought it would be easy. I did what I believe to be exceptionally well from my previous studies. And again, most accelerated programs, if not all accelerated programs, um, require you to have at least a bachelor's degree in some other area. Um, and with the way nursing school or accelerated nursing schools are now in regards to requirements, they really look for high achieving students. I believe my incoming class, our average GPA coming in, from what I heard, uh, was a 3.7 around that area. And of course, I went to a school up in the Northeast. Corridor of the United States, where there's a large population. Clearly, with all the cities, with Boston and New York and Philadelphia and D.C. and Baltimore and everything else in between there, you have an influx of uh, prospective candidates who want to get into this field because, let's face it, there is a nursing shortage, or at least an alleged nursing shortage, and jobs are hard to come by these days, including nursing jobs. But some of the benefits with becoming a nurse is that you get a decent salary. You can do it in as little as 11 months. I've seen, such as Drexel University in Philadelphia. Let's say you can do it um, in 15 months. That was my program. Some I've seen for 18 months, but in the end, typically less than 2 years, right? And you get to work in a hospital, and if you want to, you can wear a cool like white lab coat. So be it. Um, you get benefits, and yeah, it's a career that is burgeoning, and it's been that way for some time. But with all the different stats that are coming out within the next 10 to 15 years, with how many nurses that are retiring, they're going to need a lot of nurses. But the bottom line is that typically with accelerated programs, the threshold into getting accepted is a lot higher, from everything that I've read. And um, with that said, they typically accept people definitely with over, you definitely need over a 3.0 GPA in, I believe, any accelerated program. And really, it's going to be even more than that. Again, like, we had an incoming class of 35 students, and just based off of all the averages that our assistant dean told us, the average GPA of our incoming class was about 3.7. So, yeah, that's pretty high, and that's that clearly is high achieving. And I graduated actually with a bachelor's and a master's degree. Prior to this, I was actually an educator, and in both degrees, I did very well. And so the reason why I'm saying that is because coming in, just based off of my achievements in my other degrees and my other programs, I just thought that nursing school would be easy. I really did. And I thought it would be a breeze. I looked at how many nurses there were out there already, kind of blinded by um, the fact that you can get a nursing degree from a community college, the fact that there are some nurses who still work off of a diploma. I just assumed, I have my bachelor's, I have my master's. I mean, if if they can do it, why can't I, right? And it should be easy. And I excelled at the other things that I did, so why not? That is far from the truth. I have a level of respect now for all nurses, uh, when I meet them, when I talk to them, when I experience them or experienced them during my clinical. Um, nurses are bright, and you have to be bright, and you have to be constantly thinking, constantly evaluating, constantly analyzing, synthesizing information, and all that Bloom's taxonomy stuff, right? You have to be ready to stop on the dime and be ready to adjust and be ready to implement some sort of action quickly. And so you got to be fast on your feet, and again, you just got to be quick thinking, and you got to be able to work hard. Uh, Nursing school in itself is hell. As you read my title there, literally, welcome to hell. Um, and I can't really speak for your traditional nursing school, um, which is your BSN, typically a 4-year degree with nursing classes. Joined with all your other classes like English classes and math and history and whatever, all your electives like music and dance and all that other stuff that um, for me just kind of got in the way of what it is that I wanted to do when I was a bachelor's degree seeking student. And, they all have its place, sure, but the bottom line is that uh, with an accelerated program, all that extra, all those extra classes, obviously you've earned before. You don't need to take them again, and it kind of just gets you right into it. And boom, boom. Here's all the classes you have to take, and it can be overwhelming at the accelerated level. Um, some things that we want to really delve in on when you're entering nursing school is that you're going to have to do a lot of work. And alongside the work, you're going to have clinicals, right? You're going to have group projects. Uh, you're going to have to make time for studying hours on end. You're going to have to make time for your family and your social life. And you're going to have to be able to manage all of this in an organized manner. And that's where I think a lot of people have difficulty, a lot of students do. Um, we're not used to it, and when you have a semester where you have 5 classes, difficult classes, where you have a test each and every week, where you have a group presentation to do every 2 weeks, and then on top of that, you're doing 3 clinicals, 12 hours each, throughout the week. It can be pretty hard to find any time for yourself, for your loved one, for your family, or just time for yourself, just to hit the gym, even to find an hour. It can be difficult. I'm not saying that you can't get it done, um, but you got to effectively be able to organize your day, your week, your month, even to be able to get all this in. And I in the beginning I didn't use a calendar. I noticed everyone else was, and yeah, I just started that. I went on to my Google account and hooked it up to my phone, and anytime I found something new that I needed to do, it was just as easy as just plugging it into my phone. Boom, it's right there, and it alerts me. Get into the habit of that once you start nursing school. All right. Typically with these videos, again, I'm just focusing in on the prospective nursing student or the nursing student that's just started. Most of you guys who are in your third or fourth semester most likely won't need the information that I'm going to be giving you guys. And I do give you just a truthful, well, or at least from my perspective, a truthful entry into what I experienced as a nursing student. Um, most of these episodes are probably don't apply to the actual working nurse, the actual registered nurse, but maybe it will. Who knows, right? But I will be covering what to expect in nursing school. I'll be covering different subjects like pain management and um, you know uh, what to do in an emergency. Let's say with like a cardiac event, whatever have you. Those are the videos that you should be expecting um, shortly. But today, again, I'm just focusing in on what to expect at the nursing school level. Now, what should you expect in nursing school, particularly an accelerated nursing program? You're going to have to do a lot of work, and you're not going to be used to it. I mean, you came from a bachelor's program. Some of you maybe even did a master's program. In our program, we had, like myself, an educator. Um, we even had an attorney, a former attorney, who went through law school. And even if you asked her, I mean, she put the accelerated nursing program on par with her law studies and her law degree and everything she had to do for that. And I found that to be pretty impressive. And when you have a former attorney telling you that, believe me, guys, like nursing school is no joke. And particularly at the accelerated program, um, you're going to be required to do a lot of work. And as I mentioned in the first slide, time management is going to be key for you. And you need to get on it. You need to start thinking about it too. Like, how are you going to divide your time? Now, the first bullet that you see here is that you have a never-ending crap load of work, and it's true. The amount of bullshit nonsense that you have to do at the nursing level is really annoying, is questionable. I'm still uh, completely confounded as to why we had to do so many assignments that it just didn't conjoin with what we were learning, or if it did, it was at such a minimal basal level. I didn't get it. And when you go through your nursing program, you're not going to get it either. It's confusing, and uh, in the end, even if it's just basal, boring, annoying work that seems primitive, the fact that it takes up several hours of your time throughout the week, when you are fetching and fishing for hours to find throughout that week, you get really frustrated. So expect that it's going to happen. It's completely integrated into I swear it's integrated into every nursing program throughout the country, and it's something that you're going to have to go through. So just be aware, and again, manage that time effectively. The second thing that you're going to have to do is realize that the tests in nursing school are brutally confusing. The questions that you're going to get are unlike any question that you've seen already. Whether you got a bachelor's degree in engineering or in biology or art studies, whatever. I mean, um, you have not seen questions like this, and it's set in such a way where, maybe you've heard about it already, where um, you get the question, and then out of the four answer responses, every single answer response is right, but which one is most right, or which one is pertinent to the question itself, right? Or which one is considered a priority, right? Or the most important. So um, being able to differentiate and being able to locate and identify the exact answer is a nightmare sometimes, and I've found that the best way to do it is to constantly do more and more and more questions. And I used a lot of different textbooks. I used Saunders NCLEX RN examination. That was a comprehensive review book. It really broke down all the topics well for you, singled everything out, and gave you a lot of different NCLEX style questions. And again, like if you're going to an accelerated program, especially, the questions that you're going to get will mimic, at some level at least, NCLEX style questions. So um, just to get used to it and constantly reviewing more and more questions, I swear I probably did like 20,000 questions, maybe even more, throughout my entire nursing program. And I think it benefited me. I did. So, um, be wary of the questions, be wary of the answers. Sometimes like an answer looks like it's right, but there's just one word in that question, in the stem of that question, that you may overlook, or you may not completely understand, or assume you understand and think you know what it's asking you. Spend some time with the question itself, and then slowly go over all the four answer options, and you should be fine in that regard. But again, practice, practice, practice. Sample questions, and we used ATI, we used Kaplan, we used Saunders, and we had other resources as well from our professors. So just and then use your professors as well. Ask them, like, what am I doing wrong? How do I isolate the um, the right answer? What do you think I should be doing? Again, like, your professors are experts, and your professors, the fact that they are professors, most likely they did well in nursing school, and most of them are DNPs or PhDs, and so they're exceptionally bright people. So they can probably give you more detailed knowledge and understanding of how to, you know, tackle these questions. Um, the next bullet is group work, and like I said, a grotesquely amount. And this kind of like, uh, I guess, it kind of bridges with the first bullet with the never-ending crapload of work. Um, if you don't like group work, don't go to nursing school, because you're going to have to do group work, and there's no like option. Like, this isn't, it's not like elementary school where, like, sometimes your teachers is like, well, if you don't want to do group work, you can do it by yourself, because they want to keep everyone happy, and they don't want little Johnny or little Ashley running to their mommy and crying that they got to do group work, and then their mommy coming in and complaining to the principal, et cetera, et cetera. This isn't that. You're expected to do group work, and there's no like if, ands, or buts about it. And if you don't like group work, nursing school is really, truly going to be hell for you. And you are not, I mean, you're already not going to like nursing school, but it's going to be to the point where you may even want to quit, because the amount of group work that, at least that I had to do in my program, was at such an elevated level. Most of the stupid assignments that we had to do, most of it involved group work. Now, I came from an exceptional class. I really enjoyed my classmates, and it's the reason why group work wasn't too bad for me, and I'm sure for anyone else in my particular program. But we were more of a unique class, where no one really took life seriously, and so we joked around a lot, and it made it go by a little bit better. But even with all that, it was still annoying. So be prepared for a lot of group work, dealing with different personalities. As you see my little picture over here from The Hangover, and it's true. I mean, you're going to get like that one member that will do a brunt of the work. Um, and then you're going to have those that are just completely lazy, and then you're going to have those that don't show up, or they come late. You have those that distract you when you only have an hour or two to actually do the group work, meeting up in the library. So I'm just constantly talking about whatever, what they did in the weekend, or which professor they think is cute, or whatever it might be. And you're going to have to deal with that BS of like this carousel of personalities. So expect that. um, the next bullet, certain professors who don't give a shit. That is absolutely true. You have great professors, and then you have the professors that just don't care. And you're probably already used to this at the bachelor level, coming into an accelerated program. That that's the case. And even for those that are coming from the high school level, that there are teachers that care, and then teachers that are just there for a paycheck, right? And at the college level, you have professors who truly do care for teaching and are true inspirations and pioneers, and you have those that are just there for the research, and there because it's a cozy job, there because it's a prestigious job, depending, maybe at what college you work at, and are there for research and for getting grants and for going to their stupid little galas and having fun, and not really interested in the teaching aspect of it. But to fulfill their contract with the school, they have to teach. But you can just tell, like, right from the get-go, they don't put a lot of effort into it. They don't put a lot of time into it. And even with like even taking like a test, and knowing your grade, what grade you got. And you have some professors that take 2 or 3 weeks to even post it, or you have other professors that within like the hour after taking a test, they have it posted for you. And usually with our tests were done on computer. Our grades would pop up anyway, but still, with all of our tests, a lot of our professors had to like go back and make sure that all the questions still seem fair. There was no deviation from any of the questions where like one question was just completely, just percentage wise, like a lot of the class was getting it wrong. Typically, if that was the case, they'd probably, go ahead and throw that question out. So, normally you will know your grade, and then give or take maybe 2 points, maybe 4 points above that. But even then, but still, just professors that just don't care, and that's just part of it, I guess. When you're at your clinical for the next bullet, you're gonna have professors, clinical professors, who truly want to see you cry, and just mean professors that are there. Um, they just want to haze you, and they just want to put you through hell, and it sucks. It really does. Maybe they forget that they were in nursing school at one point. A lot of these clinical professors are dinosaurs. They've been there for a really long time, and they just don't get it, and um, they don't understand that you're a brand new nursing student. You're not even a nurse yet. I mean, the fact for most first year nurses, if you look at like the stats, a lot of them at the end of their year, at the end of their first year as working as a graduate nurse, a lot of them want to leave. They're already like getting burned out, right? And then we're talking at the nursing students level. I mean, how much do you know, really? And I understand there's a level of severity there, and you want to be careful and you want to be safe, even as a nursing student, for the patients that you're with. But you're not expected to know everything. And um, we had exceptional clinical professors who were stern and who wanted you to do your work, but they were understanding. And if you weren't getting it, they'd sit you down, and they'd go over things with you, And then you had just others that just yelled at you, screamed at you, just completely unprofessional, to the point where like the other staff members, not even nurses, like the other physicians and the physician assistants and nurse practitioners and physical therapists that are on the floor. I mean, even they would be like, "What the?" Like, what's going on here? Like, why is this person screaming at this poor nursing student? So, you know, that's again something that you might have to deal with. And then some of the other can't even speak right now. I apologize. Miscellaneous nonsense. Just being a male student, I guess. We only had 4 males in our entire program. There were 35 of us. If you're a male student coming in, yeah, I mean, again, I was a teacher prior to all of this, and so uh, I was kind of used to working in a profession that was still dominated by females. And believe me, I have nothing against females. I mean, um, nothing like that at all. But if you're not used to that, if you're not used to, you know, as a male being around, 40 females, and um, if you're not accustomed to that, you might feel like an outsider, whatever have you. Again, like my class was really cool. They were embracing, but I can see, maybe in other nursing programs where like a guy could possibly feel a little, you know, kind of like on the outside looking in maybe, or feeling like they were judged or put on the spot or, whatever it might be, so, um, that's some of it. First semester we did a lot of bed baths and, um, a lot of like bed changing and a lot of just like monotonous, boring, just cumbersome work, at the clinical. I didn't want to do that, I want to really start learning about pharmacology. I want to really start learning about patient safety. I wanted to start learning about um, what different conditions meant, what it meant to intubate, let's say, or mechanically ventilate, what all these different lab values were at. I wanted to learn that stuff, but the way our program was structured, first level, you're doing a lot of that basal, just like just stupid shit, man, and it got really annoying. But come like semester 2 in our second clinical, you're expected to do a lot more, and then there's a jump from like that, just that basal level of nursing, and you're jumping into, now you're passing out meds, and now you need to learn about meds, and you need to give out meds, and you need to know different dosages, safe dosages to unsafe dosages, and you need to know how to assess a patient who comes in with a cardiac event, as opposed to a patient who's having GI issues, as opposed to a patient who might be going through a possible transient ischemic stroke, right? So that was cool, right? Um, but in the end, that's some of the stuff that you have to go through. As you look at some of the pictures on this slide, right at the bottom there, bottom left corner, I'm not into like that Florence Nightingale horse crap. I just think it's stupid. I get it has its place, but I'm a guy. I'm not interested in it. Like holding candles, and wearing white hats, and whatever. Just who gives a shit, and I'm not there, and I think as a male nurse, I want to see more manliness in the field, and that was something that I was interested in. But again, if you're not comfortable with doing all that stuff, and again, like our nursing program, we didn't have to do that, but I do understand that there are nursing programs that still really value, all that traditional garbage, and whatever. But that's just some of the things that as a nursing student that coming in that you're going to have to deal with. I hope this video was to some degree helpful. If it wasn't, I apologize, I guess. But you can comment, and if you feel as though as a nursing student, one that's actually gone through all the different elements and all the different levels, that you had a different experience that contradicts what I'm saying, by all means comment on it. Again, this was my experience, and if you don't like something that I've said, by all means comment on it. Tell me that you're an idiot. I don't care. It doesn't hurt my feelings. I don't toss and turn in bed, thinking about it. It's just what it is. So, again, I hope it helped, and be sure to look out for more episodes on BenRN, and I'll begin with like pain management and how to assess and all the different nonsense that you're gonna have to go through. And it's not nonsense. It's important, but for me, the reason why I'm doing this channel is to give you the bare bones, and to really have you lock in on what I deem to be the important stuff. Okay, and I hope you get something from it. To all the prospective nursing students coming in that have already been accepted, congratulations. You're coming into an awesome field, a field that's very demanding, a field that where you're not, a lot of times you're not praised for. But it's a rewarding job, even at the nursing student level. I had patients who really embraced what I did, and it made me feel good. And best of luck to you, to all those that are applying to nursing programs, or at least interested. Get your grades up, work hard, and again, go out there and volunteer to boost your resume if you don't have the best grades. Anything's possible. Okay, and I wish you all the best. I will see you soon, and continue to follow me. All right. Talk to you soon. Bye.